Hello, everyone. Welcome to the, let's see, what is today? The May 14th statewide substance use response working group subcommittee meeting. It should begin at 11:30 a.m. I think we'll go ahead and get started. And I would ask Crystal if she can go ahead and do our call to order.
Hey, Crystal Duarte for the record. I'm going to call the names of our assembly members, although as you all know, they are not required to be here because it is still the legislative session. Assembly member Ken Gray. Dr. Shayla Holmes.
I'm present.
Dr. Terry Kearns.
Present.
Nancy Lindler.
Present.
Christine Payson.
Just of note, Ms. Payson did contact me and said she may be a few minutes late. So just advise us when she comes into the meeting, please.
She appears to be here, but maybe is not off of mute or might be doing something else. So I'll call the next name and then come back to Christine. So Senator Jeff Stone. Okay, with 3 members, possibly 4 present, we do have a quorum.
Great, thank you. We'll move on to item number 2 on our agenda, which is public comment. And I'll start by saying public comment will be received via Zoom meeting. Public comment shall be limited to 3 minutes per person. This is the time devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public unless the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241.020. And then additionally, if you are dialing in from a telephone, please dial 669-444-9171. When prompted, enter the meeting ID 868-3331-1069, and then press *6 so that the host can prompt you to unmute. And members of the public are requested to refrain from commenting outside of the designated public comment period unless specifically called upon by the chair. Do we have any public comment?
Chair Kearns, I don't see any hands raised or anyone coming off of mute, but just a note that if you did want to make public comment at this time, you can raise your hand and the chair will recognize you. We do have a few more people coming in. I would also just note that please only use the chat for technical issues, as anything in the chat becomes part of the public record. And Chair Kearns, we did just have someone join. I don't know if you want to ask for public comment again or wait until the end of the meeting.
Okay, at this point, we are doing item number 2 on our agenda, which is public comment. If anyone has public comment, please raise your hand and be acknowledged. If you don't, we will also have another public comment session near the end of the meeting. I am not seeing any raised hands, so I think we can go on to the next agenda item, which is agenda item number 3, which is our review and approve minutes from the March 4th, 2025 response subcommittee meeting. If there's any discussion from the committee members on the minutes, please bring that up. If there's none, if someone would like to make a motion to approve the minutes.
Shayla, I'll make the motion to approve the meeting minutes.
Thank you. Shayla Holmes made the motion. Do I have a second?
This is Nancy Lindler, I'll second.
Thank you. So Shayla made the motion, Nancy Linder seconded it. We'll take a vote. All in favor, say aye.
Aye.
Aye. Any opposed, say nay. And if there's any abstentions, hearing none, the meeting minutes are unanimously approved by those members who are present. That will move us on to agenda item number 4, which is a presentation on the Good Samaritan Drug Overdose Act, community education, and prescription take-back programs. And this is going to be conducted for us by Jamie Ross. Oh, Christine, do you have a question? I see your hand raised.
Hi, I dialed in. I'm just wondering if you guys can hear me.
We can hear you. Thank you for double checking on that.
Okay, thanks.
Jamie, if you are on the call or on the Zoom meeting and ready, we're ready to hear your presentation.
Fabulous. So it's actually going to be me and Daria Singer, who is on as well. She is our subject matter expert in the intersection of prevention and law enforcement. So she's going to be talking about half of this. I'm going to hit the present in Teams button and we're going to see how it works. So please provide me grace. Oh, also Jamie Ross for the record. Okay. Nothing's happening on your end, right? Cool. All right.
You should be able to share your screen, Jamie. This meeting doesn't have any restrictions on that.
Got it. Okay. What's telling me to join a meeting to present? Awesome. We're not gonna do it that way. We are just going to share screen in the Zoom meeting because I know how to do that one.
Technology with all these different platforms is always so much fun.
It is. It is. Let me go ahead and get I apologize. From beginning.
Jamie, I can also screen share.
Fabulous. If you can get it working, that would be amazing because every time I try and screen share, it decides to take over all 3 of my screens. So I can't even see where the share button is.
Yeah.
It's fun. Thank you.
And we see your presentation, Daria.
Perfect. Do you see just the presenter view or the
Yes.
one with? Okay,
It's in presentation mode.
perfect. Thank you all for the record. My name is Daria Singer and I'm the Executive Director of Partnership Douglas County. And today Jamie Ross and I are going to present on the Good Samaritan Law and pill disposal.
So this is a list of a map of all of the counties, as well as which prevention coalitions oversee each county. As you can see, there are you guys know there's 17 counties and we have 10 coalitions serving all 17 of them. I think one of the reasons we were asked to present is the coalitions were involved in the 2015 passage of the Good Samaritan Law. One of the things our prevention coalitions do well is we are able to take statewide information and localize it to our communities. So that's really what we've been doing about the Good Samaritan Law. And as far as pill disposal, we've actually been doing pill disposal in collaboration with law enforcement since about 2010. We worked with the DEA and Governor Sandoval to start this process many, many moons ago. So I'll go ahead and pass it back over to Daria.
Awesome. So Daria Singer for the record. I'm going to be covering the Good Samaritan Law and where we're at with community trainings. So we have trainings conducted by multiple coalitions across the state. Many include the Good Samaritan Law in our naloxone training. So while we're out in the community talking about harm reduction, getting naloxone out there, we're also talking about what the Good Samaritan Law is and how it impacts individuals that may be utilizing substances and have a fear of calling for 911 assistance if an overdose or something was to occur. We have many peers and community health workers that are also trained in the Good Samaritan Law and are providing that education across the state. JTNN, which is Join Together Northern Nevada, they serve Washoe County, has created a Good Samaritan media campaign that they are working on also sharing with the other coalitions so we can have that information statewide. Currently, there is no funding for the coalitions to train on this topic, and hence why many of us include it in our naloxone training since we are funded to do naloxone trainings. One of the things I wanted to add to this piece is some coalitions have stepped back from talking about the Good Samaritan law due to conversation needs with law enforcement. So in the South, they use a presentation created by Southern Nevada Health District, and they no longer include information on the Good Samaritan law in there because their law enforcement agencies are not necessarily willing to honor that. So if, say, I were to overdose and Jamie's with me and Jamie calls 911 and she's also engaging in the act of using substances, she's supposed to be protected under the Good Samaritan law, like many of you know. However, in some law enforcement communities, they're not willing to honor that per se, and she may fear prosecution and is not willing to call to get me help if I'm overdosing. So kind of adding just to that. And we have to be careful on how we frame it. So Jamie said that I was a subject matter expert on kind of the law enforcement prevention piece. I do have a background in law enforcement. And so one of the ways we've been able to successfully talk about Good Samaritan law in Douglas County is we frame it under the guidance of if you are engaging in the act of using substances and you call 911 to get help to save someone's life, you are protected under the Good Samaritan law. However, if you have an outstanding warrant, if you have a gun on you, if you just broke and did a B&E, broke and entered into someone's home to use substances, you are not protected from any of that. It is only for calling for help and if you are using substances at the same time. That's been really helpful for us in our community where they understand now that they still need to call 911 and get help. They may not be fully protected, but it's in their best interest to do so. We'll take questions at the end if you have any questions on this, and I'm going to pass it back over to Jamie to talk about medication disposal.
Thank you, Daria. So yes, Jamie Ross for the record, and medication disposal. The reality is once someone acquires a medication, whether it be prescription or over the counter, there are a plethora of ways one can dispose of the medications. So the kind of longest standing and easiest way, if you're willing to wait till twice a year, is the pill take back days. Those have been done with the DEA for many, many years now. DEA normally does those the last Saturday in April and the last Saturday in October. Depending on where Nevada Day falls, sometimes the October one is a little squishy, but DEA pill take back days are all over Nevada and all over each county in Nevada. Many of our law enforcement entities, but not all, have disposal in our local law enforcement offices. So that means if you go to the sheriff's office in our community, our smaller communities, or if you go to a substation or an area command in a larger community, you will be able to see a drop box. They're almost always, you don't have to go behind anywhere. You don't have to talk to anyone. You just go dump your meds and leave. There are some hospitals, especially in our rural communities, that do take medication disposal. There are some commercial pharmacies, especially in our urban areas, that will take medication back. And then there is also disposal utilizing disposal pouches, disposal buckets, depending on what exactly we are talking about and what the location is. But every one of our communities has disposal pouches. So unique collaborations, some of the cool stuff that's happened that I would like you guys all to know about. Most of the incinerators that currently exist for medication disposal were purchased with funds in collaboration between the law enforcement entities, the coalition, and then some of it was AG money, some of it was, I think, state general fund. There's a multitude of places and times that this money has come out. And what we know is incineration is a barrier. So often our coalitions, when we have pots of money that will allow unique collaborations like this, we often encourage our law enforcement to house those incinerators. Our coalitions often purchase disposal bags through grant funding. Also, there has been a multitude of community providers who have bought those bags in bulk. We call them doTERRA bags. And there's a couple of companies that do that sort of work. It doesn't need to be doTERRA. They are the Kleenex of the pill disposal world. We have the pill take back locations that are open year round, that are in our pill take back locations, include schools, pharmacies, law enforcement offices, and community centers. Our coalitions also, many years ago, we're talking like 2010, 2012, wrote grants. Many of the disposal boxes, like the freestanding boxes that live year round in our communities, were purchased through, again, collaborations between law enforcement and our prevention agencies to buy those funding. And we actually do have a mobile incinerator purchased by a coalition that can go to anywhere. Next slide. Some of the concerns. Law enforcement disposal in some communities is difficult. The further you get away from a big city, the physically longer the distance is, so the harder it is to get it to an incinerator. Most of our counties have found a way around that, and all of our counties are taking the medication in some way, shape, or form. Oftentimes our disposal locations will only take solids. Some will take liquids, but disposal of sharps and aerosols continue to be a challenge. No one will take sharps, and aerosols, same. You cannot incinerate something that is an aerosol container. I think hopefully you all already know that. And then the future of the DEA pill take back days are uncertain due to the general uncertainty.
I'm here, and I was hoping I could just talk around.
Thank you, Sherilyn, for muting. The future of the take back days are uncertain. The DEA was told originally that the one that we had last month would be the last one, and then that information was rescinded. So it's now a question mark on whether or not the DEA will be able to continue with that. Next slide, please.
So some gaps and needs, this is Daria Singer for the record, that we've identified for the Good Samaritan Act and pill disposal. For the Good Samaritan Act specifically, we're looking hopefully for a statement from the Attorney General on the Good Samaritan law, going out to other law enforcement agencies, sharing the benefit of the law and also the fact that it is the law, and so it should be honored in those situations where individuals are calling to save the lives of others. Of course, we're going to ask for funding to support the community trainings for the Good Samaritan law, because we know that's best practice. Is if we can support ongoing training, we can potentially save more lives by educating individuals on the benefits of this act. And then for pill disposal, continuing the DEA take back days if the DEA itself does not continue it. So start our own Nevada version. Still do it maybe twice a year at the same time. So people are so used to April and October, and hosting those large community take back days and then paying for transportation to get those to the incinerators. When Jamie and I were prepping for this, she shared that historically how it's worked is Reno collects all of Northern Nevada's pills. They then fly it down to Vegas. Vegas then puts all of it together and then flies it to Long Beach, California to dispose of it. Now Vegas is taking one box at a time up to Pahrump in order to get it incinerated there. And typically in one take back day, they get 38 boxes. So that's 38 up and down trips to Pahrump to get that incinerated. And then funding for alternatives for take home disposal. In Douglas County specifically, we worked with the Attorney General's office through ODMAP funding, and we're able to place 5 take-back boxes year-round and pay for a lot of doTERRA using the ODMAP system to identify hotspots. Not every community's been as blessed as we have been here in Douglas with that. And so having funding for other alternatives so we can continue to dispose of medication year round instead of having people stockpile it and wait just for those 2 days, because then it's in the homes and it's more accessible compared to just getting rid of it. Anything I missed, Jamie?
No, I think that is it. Thank you so much. We'll take questions.
Thank you both for that informative and thoughtful presentation and the recommendations at the end. I wanted to highlight, which I forgot to before you started, that this presentation relates to two of the recommendations made by the response subcommittee in 2024. The first was to resolve the conflict between the Good Samaritan Drug Overdose Act and drug-induced homicide law. Immediate actions may include recommending community-level education using best practice guidelines, as well as education for law enforcement personnel and exploring options for altering the Good Samaritan language to expand coverage to a greater population of individuals living with substance use disorder. And the other one was to implement a voluntary program to install drug take-back bins in retail pharmacies. So I did want to highlight that. I will open it up to committee members if you have any questions.
This is Shayla Holmes. I don't have any questions, but I do just want to say thank you for your guys' time and your perspective on the current issues. I was totally unaware of the incinerator problem with the medications, although we have heard quite a bit as far as the difficulty with the Good Samaritan law for folks using and encouraging them to call. So I appreciate you bringing that perspective back around and then adding that new piece of information for me.
Yeah.
One thing I would highlight is when we first brought this up, we did go to, through Christine Payson, who's one of our committee members, go to the DA's Association and the chiefs and sheriffs and look at if law enforcement was indeed arresting people when they went out on overdose calls. And from what I remember, it was a very small number, just one or two over the years. And Christine, if you remember anything about that, I would ask that you can highlight that.
Yeah, it wasn't a real large amount. They're, like we've talked before, they just don't have the time or the jail space to be arresting a low-level offender that's just under the influence or using. They're going to be focused on addressing the overdose if there is one, or a lot more serious crimes than that.
If I could add to that, Daria Singer, for the record, I did not mean to insinuate that our deputies are out there arresting people in need, but what we're seeing is that certain sheriff's office and police departments are not as comfortable with the Good Samaritan law and prefer that word don't provide as much education out there because they don't want to perpetuate the story that that may happen, that case where deputies will show up because people don't understand what the law is. And so we find typically more with our rural communities that they're less comfortable with us educating on it. And that's why we were hopeful to have the Attorney General's office maybe help give them some guidance on the benefits of the Good Samaritan law. Thank you.
Yeah, thank you for clarifying that. I appreciate it. And I know previously there had been some education done, but I think it may be a case of continued education. So I appreciate that recommendation. And I know not in this legislative session, but the last one, I heard numerous members of the public testify that they were afraid to call 911 out of fear of being arrested. So it's real or perceived, whether they will be arrested. It's a real fear of some members of our public. Do we have any other questions for Jamie or Daria? One of the things, while we wait just a moment to see if there's any other questions that I would highlight is the incinerators that were purchased by the Attorney General's office that went out to 5 law enforcement agencies. Were supposed to be geographically spread throughout the state. And the original purpose was to be able to dispose of seized drugs, but also with the agreement that they would also incinerate drugs from drug take-back days. So we do have those, and I don't have all of the locations currently, but I can definitely get where all of those incinerators are located at. Hearing no questions, I just ask either Jamie or Daria if you have any closing thoughts.
Thank you so much. We are excited as always. The SURG always puts out a great annual report that we are always excited to be a part of. So thank you for all the incredibly hard work that goes into doing all of this. It is well received in the community.
And I'll just echo what Jamie said. Thank you all so much.
Yeah, thank you. And we really appreciate your partnership and all the things you do in the communities to help Nevadans with not only substance use, but all the other things you do as well. Thank you. At this point, we'll move on to agenda item number 5, which is a review of the progress on prior SURG subcommittee recommendations. And I would turn this over to Laura Hale.
Thank you, Terry. Good morning, everyone. And we got a request from the Prevention and Harm Reduction Subcommittee to provide some updates on past recommendations. So we kind of scrambled and did get a lot of updates just in the last week from programs under the Department of Health and Human Services. So we're updating some of the recommendations based on those responses. And some of you will remember that we had some updates last October from them as well. So we tried to combine information over multiple years of the SURG work, but we also wanted to provide some of these process considerations for folks. And when you're making recommendations, the time that it takes for an agency to respond can vary. And so, for example, if it's a budget issue, usually the state agencies will be 2 to 3 years out when they are submitting their budgets for the biennium. It has to go through a long approval process. And so if you're submitting something that impacts their budget, you really want to do that, give them a time frame that's far enough in advance for them to try to include budget recommendations. And so this just gives you an example, like for the 26-27 biennium, that process began in March of 2024. So it has to go through reviews at the department level, the division, the department level, at the executive governor's office and so forth. And so just something to keep in mind. With bill draft requests, if you're going to put that forward, it helps to direct it to a specific person or agency. So a legislator can put forward bill draft requests. Executive agencies have a certain number of bill draft requests that they can put forward each year. They also have certain timeframes. So if it's coming from the agency, usually those are due late summer, early fall, the year before a legislative session. Legislators and legislative committees obviously have a little longer time frame that they can submit those for. In some cases, some boards might have a bill draft request that they're allowed to submit for each session. So again, just thinking about deadlines and how you work with different groups and needing to put things forward to specific entities who can actually do that. And then if you can go to the next slide, Crystal. So this is an example of state plan amendments that go to the Division of Healthcare Finance and Policy, and they have to submit those to the federal Centers for Medicare and Medicaid. And those can take from 90 days to over 2 years. So when they're getting a recommendation to do something like that, that requires one of those state plan amendments, just again, think long-term, it's going to take them a while to achieve progress on those kinds of things. And then on to the next slide. So last year, as I mentioned, we did get updates from various divisions under the Department of Health and Human Services and those respective programs. That was October. We talked with them then about doing that each year in October because for a lot of those, the grants, particularly in the Division of Public and Behavioral Health, their time frame is such that it works best for them to give updates at that time. So we will look to do that again in October, but we kind of have these interim updates because of a specific request. And then, yeah, so that's the specific request there that's referenced. And so we're developing this tracker. It's still in draft form. Once we finalize it, we'll make that available to everybody. But in the meantime, I will review with you a few updates. And if you can go to the next slide, we'll start the other document, Crystal, then we'll go through those. So I pulled this out of a larger document that has all of the subcommittee recommendations and updates. This one I selected out specifically for response, and then also there are some that they're grouped together based on the subject matter. So in some cases, recommendations across different subcommittees might touch on a similar issue, and they might have updates that relate to those different subcommittees. And so there's another group that you'll see after this that is those mixed recommendations. But these updates were provided to me by Brianne Van Dyne with the Division of Public and Behavioral Health. And so those just came in last week. And the response recommendation, this one is from 2023, evaluate current availability and readiness to provide comprehensive behavioral health services, to include screening, assessment, treatment, recovery support, etc. So these are grants that went out under this program. And you can see there's several there that respond to different elements of that recommendation. So these are ongoing work. And in addition to the recent updates, you can see there's also, I included the stuff going back. So October 24, that was one of the updates from that bureau that was provided at that time. So if you can go ahead, yeah, there you go. So here's another recommendation from 2023 to leverage existing programs and funding to do outreach, to carry overdose treatment and do support referrals and services to the individuals following an overdose. So you can see again, there are 3 different grants that went out that are current for that particular purpose. So the PACT Coalition, 9 Communities Coalition, that should be Partita Corona Medical Center. And just so people are aware, there will be a presentation to the treatment and recovery subcommittee. That's going to be next week. And so if you're interested in hearing more about that, they will have a presentation with that subcommittee next week. And then you can see, again, there's some October 24 responses that were made to that particular recommendation. If you can go down to the next screen, Crystal. So this was about the Clark County Overdose Fatality Review Task Force and reviewing those lessons learned. So that was something that was recommended in 2023, and then there's an additional note there for 2024 that funding to be provided through the Fund for Resilient Nevada, and to support this recommendation, additional funding may be needed. And so then looking down to 2022, there was also a related recommendation. And as you know by now, that Fatality Review Board was approved, and so we will track those reports going forward. But this is just to let you see over the years where there have been similar recommendations and how the Department of Health and Human Services has responded to update the SURG members about those items. So we can go on to the next one. Understand what coroners and medical examiners currently test for and make recommendations to a specific agency. So all of the responses that we have for that are from last October. So we didn't have any current updates for that one. And then the wastewater sampling, I'm sure you're aware that first recommendation came in 2023, and then it was sort of broadened in 2024. We don't have an update for that yet. And that's true for the rest of the 2024 recommendations. But there are some that were similar to recommendations that were made from other subcommittees. So if you can keep scrolling down to the next section, Crystal. So this is the 2024 response. The number one recommendation was the to have a statewide data sharing agreement with the chief data officer for the state of Nevada. And there have been similar recommendations. So in 2023, the prevention subcommittee made a recommendation related to having a data dashboard. It was specific to having outlets reported for alcohol, tobacco, and cannabis. And then from 2022, also prevention, supporting a backbone agency that specializes in data collection, evaluation, analysis, and assessment, and provides consultation to entities across Nevada to help improve internal local data collection systems, creates a comprehensive statewide data sharing system. So that one's a little more consistent with the response recommendation from 2024. And we did get comments from DHHS back in October of 2024. And so you can see what those are listed there. So to the extent that the Office of Analytics can be responsive to those requests, they will try to include the kinds of data that you're asking for. And I think scrolling down, the rest of them are other subcommittees that are combined. So, you know, in this case, prevention and harm reduction had similar recommendations, and those did have some updates from last week. And then go down a little bit further, scroll down a little bit further. So some of these also have legislation that is related, and the larger spreadsheet will show that. So 2025, there was, you may recall, there was a bill that was put forward by Treatment and Recovery to have opioid antagonists available on all campuses. That is moving through the legislative session. There are some changes, amendments that have been made to that bill. It was amended and did pass through the Assembly, and then it also passed through the committee in the Senate, and it will likely go onto the floor and get passed out. In 2023, there was legislation related to the opioid overdose task force, so that reference is there. And this spreadsheet, once we get it finalized, is just to try to serve as a tracker for members of sort of a broad look at the different recommendations that you've made over the last few years and how they relate. You know, they're grouped in categories that kind of relate to each other, and then the updates, corresponding updates that have come from the Department of Health and Human Services. And sometimes those updates may not be specifically putting into action the recommended request, but it's related. It will always be related. You know, there's a vast range of recommendations and there's a vast range of responses that occur under different programs within the Department of Health and Human Services, and obviously different bills that can go pass through the legislature that may or may not have been based on a recommendation that comes from the SURG, but nevertheless, it can impact a lot of the work that you do. So this is our effort to try to be responsive and let people know the different types of tracking that we're trying to do and make available to members. And sometimes the timing can be a little bit difficult because during a legislative session, it can be hard for folks at the Department of Health and Human Services to be quickly responsive, versus, you know, when it's outside of the legislative session, they might have a little more space to come and report in person to the SURG members and also be able to answer questions that folks might have. So, you know, we did have Don Yohe from the FRN give updates at our last SURG meeting, and we will have those kinds of updates available when possible, but we're definitely looking in October to have this broader kind of tracking of a lot of different recommendations. And we'll also do an update in July with once the legislature has wrapped up with kind of the final status of some of the bills that members of the SURG might be interested in. If there are questions or comments, I can try to respond.
Thank you for that, Laura. Before we take any questions, I just wanted to highlight a couple of updates to the 2024 recommendations. The recommendation about the data sharing and the dashboard from our Chief Data Officer from the Office of the Governor on March 26th. The State Data Governance Committee was formed and is now meeting regularly. As a relatively new committee in the executive branch, it is currently focused on the strategic planning to prioritize activities in the year ahead. And while there are many areas of data governance to consider, standardizing data sharing agreements is one area that the Chief Data Officer believes will be addressed in the near term. Many other states have prioritized simplifying these agreements so agencies can share their data more easily and confidentially. Then regarding the interoperability and integration between existing systems, a goal often realized through more modern data architectures, a longitudinal data system or multi-agency data warehouse could help with this kind of analysis, or possibly an integrated data platform that updates frequently enough to support multi-agency coordination. He's not currently aware of any new systems under development that match this exact description, but he remains fully supportive of efforts that encourage secure and ethical data sharing to meet important objectives such as those identified by the SURG. He would defer to leadership at DHHS or NDOC regarding any specific plans for the type of system the committee is their committee or we are pursuing. He also connected us with David Axtell of OCIO's Chief Technology Officer, who oversees the group that handles technology investment notifications. And Jason asked David to alert him to any new investment concepts that match this general description. So just wanted to highlight that. And then if the committee members have any questions. Hearing none, thank you, Laura and SEI, for all the hard work you've done in updating all of the recommendations and getting the information. I know it's a lot of work to do this, but it's much appreciated. And will this be on the SURG website, or where will we be able to find this information, Laura?
Yes, we will make that available to SURG members. We just haven't had time for an internal review of it. So in fact, I found some errors this morning, and so sent to Crystal this latest version because there's so many moving parts to it. So once we feel confident that it is accurate and finalized, or at least up to this point in time, then we'll make it available. Thank you.
Thank you. I appreciate the presentation and again, the hard work on pulling all this together. I know it's not a quick or easy task to do. At this point, if there's no questions from, yes.
Sorry, I don't know if anybody else is experiencing odd audio sound.
Yes.
I am.
Okay. Yeah, sounds like other people were here. It was just very fuzzy. But Terry, maybe try again.
Can you hear me better now? Okay. Apologies for that. Again, I just want to thank Laura and SEI for their hard work on this. I know it wasn't a quick or easy process. At this point, we'll move on to item number 6 on our agenda, which is to review the 2025 Response Subcommittee meeting topics. And currently, we have, as you can see on the slide, we have some topics and presenter suggestions. The first is the Emergency Bridge Program by Dr. Kelly Morgan, and that would be in our June meeting. And then the wastewater-based epidemiology, which is by Dr. O and Dr. Garrity for June as well. We've had the recommendation of workforce and then also defining recidivism. So I would highlight to you that I think that Sherilyn and Dr. Katie Snyder had originally presented to us on the need to have a definition of recidivism. So Dr. Snyder and I have been asked to do a presentation to the Sentencing Commission, and we are also gathering information from other states concerning that definition of recidivism. So more to come on that as well, and hopefully we'll have some updates on that. If any members have any other ideas or presenters, please email the subcommittee staff with any recommendations for speakers. Crystal, do you have anything you want to add?
I would just second that encouragement about any speakers you have. If you don't have a recommendation yet, we're going to talk about that process, but you don't have to have a recommendation to have a speaker recommendation. So please, if there's someone in the field you want to hear from that relates to the topic areas covered by the response subcommittee, reach out, connect me with them, or ask. I can do some research if there's somebody that you would like to have identified. Because we want to make sure that we round out the recommendations for this year and that those are informed by subject matter experts. On the workforce, we have talked about having Dr. Hunt from UNLV present. I think Dr. Hunt presented a year ago or so to the full SURG. So that is one presenter we might go back to. If you had other recommendations on that specific issues or other ways you see the workforce impacted by substance use that we could explore, that would be much appreciated.
Thank you, Crystal. And as noted, our meeting dates are at the bottom of this slide. We should meet again on June 3rd, August 5th, September 2nd, and November 4th from 11 to 12:30. If there's no comment or questions from committee members, we'll move on to the next agenda item, which is agenda item number 7, to discuss 2025 response subcommittee recommendations process and any proposed recommendations. And currently, we don't have any recommendations that have been submitted for the response subcommittee. I know that in our meeting, we wanted to kind of find out where we were with previous recommendations, as well as looking at recommendations that may be sitting currently with the current legislative session. So I think that's likely why we haven't seen any, but it's really important to note that the earlier recommendations are submitted, the more time we have to schedule presentations and to refine those. And so please submit any that you may have as early as possible. And each committee member is encouraged to submit at least one recommendation. Again, the recommendation doesn't have to be a new recommendation. It can be just kind of going back to a previous recommendation and maybe refining it, or some additional information that may need to be added to that. And as Crystal mentioned too, it doesn't have to be a real refined and well-written recommendation. It can be just a thought of something that you may have, or, just submit that. And it, again, not necessarily the full wording, but just, this is what I was thinking. Any additional thoughts, Crystal, that you may have?
Thank you, Chair Kearns. Just that if the survey, which I've sent out via email and I'll send out again after this meeting, if the survey feels clunky to fill out, just contact me and I can take the information from you. That goes for a recommendation or speaker to reach out to. You can always contact me, and we can work through that together.
Any comments or questions from the committee members? Okay, hearing none, we'll move on to the next agenda item, which is agenda item number 8, which is public comment again. As previously, public comment will be limited to 3 minutes per person. Members of the public may comment on any matter that is not specifically included on the agenda at this time. However, no action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to subparagraph 2 of NRS 241.010. Do we have any public comment? I see Sherilyn Raw-Wood's hand raised. Please go ahead, Sherilyn.
Yes, thank you very much. I apologize for having my unmute, my mute button hit during your presentation, Jamie and Daria. But first of all, I want to say thank you for that presentation. Awesome information. I'm hoping that I potentially could reach out to you guys to maybe do that presentation at the Behavioral Task Force meetings, and potentially maybe at the next Nevada Sheriffs and Chiefs Association meeting, just to, just kind of keep a little abreast on that. I get asked consistently about that Good Samaritan law, especially with suicide prevention, things of that nature. So I think it's really good that we do understand how our state looks at that Good Samaritan law. And then I also wanted to add AB 60 has had its work session yesterday. That did pass. It was just a date change. Senator Donate wanted to move the start date from July to January 2026. So that passed without any issues or anything like that. So I see AB 60 moving through. And I'd like to recognize Jamie Ross and Daria Singer, as well as Sheila Holmes, the chair of the Regional Behavioral Health Coordinator, the Northern one, for the work that they've done on helping to get AB 60 passed. We've got some great subject matter experts that really bring that certified prevention specialist language to the table. as well as a few of our certified prevention specialists, Jamie and Daria being two of them, will be recognized on the Senate floor on the 21st of this month. So they'll get recognized for the work that they put really into bringing this bill forward and codifying certified prevention specialists. And one other thing, June 5th at 2 o'clock is the Northern Regional Behavioral Health Policy Board. And we'll be spending most of that meeting just going over some of the bills that have passed, focusing on behavioral health, whether it's youth or adult, as session will be over tentatively. So we'll be doing that on the June 5th meeting. And I am anticipating that Senator Titus is going to help me present on some of those bills. So it should be pretty enlightening. So that's all I wanted to say. I hope my 3 minutes are probably over.
Sherilyn, thank you so much for those updates. It's really appreciated that you did those. Yeah, and kudos again to our presenters, Jamie Ross and Daria Singer, for your presentation. I would highlight that AB 19, which is the AG's bill to increase the membership of the SURG, has gone through both the Assembly and Senate. There's some recommendations for changes to language and from the Senate, which we've already made that from the Assembly. So more to come on that, but I just wanted to highlight to you all that that is moving forward. Any other public comment? I don't see anyone else for public comment. Crystal, am I missing anyone?
I don't see anyone either.
Okay. Again, Sherilyn, thank you for the updates you provided. It's important for us to hear those. At this point, we'll finish with public comment and move on to item number 9, which is our adjournment. So I will give you about 32 minutes of time back to you because we were supposed to end at 1, but we'll end at 12:28 today. Thank you all. I appreciate it.
Thanks, Terry. We appreciate you.
Thanks, Terry.